Susie, do you remember how well-defined the PPL cases were last year? A young woman presents with Raynaud's sign, difficulty swallowing, skin tightening. You run some labs and she has anti-centromere antibodies. Now you know she's got scleroderma. So the treatment is corticosteroids, calcium channel blockers, pro-motility agents, antibiotics, supportive care.
Over what time span was she seeing you? Was she seeing other providers? Do you know?
I don't know. We didn't really talk about that.
It's good for an M1 to learn what scleroderma is and devise learning issues surrounding the disease process, but in this day and age, Itazaz, complicated patients are seeing way more than just one provider. She probably had an entire team of specialists caring for her, from GI to rheumatology to her primary care doctor, all writing different notes for her, all coordinating care. Medicine is based on an extensive communication and teamwork with our colleagues, and management of her follow-up, and providing her with the instructions to manage her own follow-up. The goal for the medical student who is more advanced in their training should be to learn how to manage this extensive and often fragmented network of patient care, how to communicate with their colleagues, how to summarize their contribution to the patient's care in a clear and meaningful manner for the next person to pick up where they left off. And no, this isn't just for the rare case of scleroderma. This is for the patient with type 2 diabetes, sleep apnea, and heart failure, the patient with fibromyalgia, depression, GI problems, and an opioid addiction, the patient with any constellation of commonly related symptoms who will inevitably see a lot of specialists. They're a lot more common than you think, and we need to be prepared. Don't you think so, AMA?